As before the lunch break, we have more, around 40 minutes, 35 minutes. The Secretariat has decided to move one item from the afternoon session to this one, and this will be the European Health Report 2018. The European Health Report is flagship publication of the WHO Regional Office for Europe, and it's published every 3 years. The 2018 report provides a scorecard of progress with health and well-being in the region, 6 years after the Health 2020 policy was adopted. It outlines how Health 2020 has shaped the evidence landscape in Europe and where the region is going with new forms of evidence in the 21st century. Now I give the floor to Claudia Stein, Director of the Division of Information, Evidence Research and Innovation. Dr. Stein, you have the floor, please.
Thank you very much, Mr. Chairman. Ladies and gentlemen, today I make your life much easier. I will stick to one language. If I could please have the presentation on the screen. Could the presentation be please put up on the screen? Thank you. Ladies and gentlemen, it is my great pleasure to present to you a project that is truly a whole of office effort. Of course, I have the privilege to present this to you, but of course this is the work of many people, not only my division, but many other divisions. Everyone is involved, and I would like to thank all the technical divisions. In my division, I would like to thank especially Masha Greenblatt and Tina Dannemann, who have moved this work forward, but it is everybody's work. And as our Mr. President said, this is our 3-yearly flagship report where we look at the health and the well-being of the European population, but also the implementation of Health 2020 in the region. We have conducted a series of European health reports with that theme, moving from describing what we mean by well-being all the way to really seeing whether Health 2020 is being implemented in the region. And as we're now in 2018, really at the halfway point of data collection, which is considering data from 2016, we feel it's a good time to take stock and to present a scorecard to you as to whether Health 2020 has been successful in this region. Now, I will not deliberate on the various chapters of the report, just to say to you that we will show you the progress towards Health 2020 targets that you adopted in 2012, and show you some graphs and figures as to how we are faring. Much of this has already been presented. We will also expand on the new direction that we're taking with the kind of new forms of evidence that we are proposing that we believe need to be mainstream in order to truly describe the health and well-being of people in this region. And then still deal with a challenge we discussed at great length yesterday in the ministerial lunch, the fact that we are still a region fragmented in health information, even fragmented in national systems, and that we need to move towards a standardized and harmonized integrated health information system in the region. Now, the key messages are very, very clear, and I think I would want us not to lose that message when we're looking at all the problems that are being described. The health and well-being in Europe is improving. It is steadily improving, and that is in tandem with the implementation of Health 2020. And personally, I believe that Health 2020 has catalyzed much of this improvement in the region. But there is a but, and the but is not insignificant. The but is quite big, and it is something we should not lose sight of. This is one of the main messages. Life expectancy is increasing. You can see this, the middle line is the regional average, and it is increasing everywhere. You also see that the differences between the highest life expectancy in Europe in one country and the lowest are shrinking. That is good news, but the but remains, and I will come to that. The but is that the difference is still very, very large. The regional director said it in her speech on Monday, more than 11 years of difference in life expectancy between the highest and the lowest country in the region. And as we just heard from our colleagues, the difference between men and women is substantial. And the difference exists in every country in the European region. This is a graph that illustrates this in much more detail, and I just want to linger a moment on this graph. The red line is life expectancy for females, the blue line is for males in this region. And you can see it is increasing, and you can see perhaps a little bit that the difference between the two is also shrinking. But there's a lot more in this graph. When you look at the top line, the dotted line in red, you see the highest life expectancy for women in one particular country, very, very high. The lowest is the lowest life expectancy in males in one particular country. When you look at the difference between 2012 and 2016, you see that difference is shrinking. However, that's still a much bigger difference than we had 50 years ago. And that's not the only message in this graph. Let us turn back to the lowest line, the blue dotted line, lowest male life expectancy in the region. It is lower today than it was 50 years ago. That's something Europe really needs to think about, and I'm so delighted that you have adopted the strategy on men's health, which I think is really making the point for this. Looking at mortality, we see the same pattern. Mortality is falling across the region. And you see that mortality is falling actually in countries where it has been the highest. That is good news, and the differences are also shrinking. But now come the buts, and the buts are pretty clear. Overweight and obesity in the European region are high and are increasing. It is one of the risk factors that is increasing, and when we look at this graph, we're looking at 11-year-olds, and we see vast differences, but we also see that in 11-year-olds in some countries, the obesity and overweight in boys is close to 40%. I always say that when I was a child, there was perhaps 1 or 2 chubby children in my class. In some countries now, nearly half of the boys are overweight or obese, and that is not a good record. And here we see how it has increased in the whole population since 2010. That is very significant. But that is not the only thing that should concern us, and we heard it from our colleagues. Tobacco use, and here you see 13-year-olds. In some countries, boys, up to 10% of 13-year-olds smoke. That was unheard of when I was a child. That should really worry us. And likewise, alcohol use, although declining, it is still very high. We're still the world champions in drinking, and I don't think that is a record we should be proud of. Although you see that the differences are wide, this is not good news. We heard yesterday from our colleagues from the Barcelona office a brilliant presentation on expenditures and financing. I could not replicate that. But what we see here is just the overall figures of total health expenditure as a proportion of GDP. These are WHO estimates. And you see that it has not really changed. The differences are still vast, and the average has not moved either. So there is still obviously a lot to do, and our Barcelona colleagues have a whole array of tools to support you in this. We see also it was actually closer and less pronounced only 18 years ago. The differences in health expenditure are vast between countries. They remain vast, and this is something that has not shifted. But what is really good news, and this is something we also heard from many of you over the course of the last 3 days, is that the proportion of countries that are aligning their health policies with Health 2020 or have other strategies that are aligned with Health 2020 are increasing. These are the first 2 turquoise bars, and we're moving from something under 60% to something now over 90%. So the vast majority of countries in this region are aligning their national strategies with Health 2020. Congratulations, this is a success for the region, and I think it's something that Europe should be very proud of. But this is not the whole story, and this is why the report is called More Than Numbers and Evidence for All. What we would like to really do now and do as mainstream is to bring in new concepts that are enshrined in Health 2020 and measure and describe them. We believe it is not enough to stick with the numbers. Numbers are great, we will never abandon them. But we need to interpret them in the right context, and we need to describe the concepts of Health 2020. And in this report, we have selected 3 and are outlining how we can do better at measuring, describing such concepts. And we believe we must do this, not just because we need to be true to Health 2020, but also because these are important qualitative elements that we can no longer do without. We as a region believe that we need to see people and their health and well-being holistically, not just as a collection of numbers. And so we believe that qualitative and quantitative information needs to be mainstream from now on, and we would always report in both areas. And of course, in a way, you're looking at new types of evidence for the 21st century. We are now exploring things like using narratives, anthropological records, and other social and humanities science elements to do so. That is a departure. I think we are the first region to do this, but we believe it's important. And then we need to bring the evidence to all. Not only our policymakers, not only our health professionals, but everyone. And this is also one reason why we have created the Gateway. But how will we actually do this? Now, this is a big challenge, and because we're the first, we have to really blaze a new trail. We must make sure that the new measures are aligned with Health 2020 and have relevance to the SDGs. They are with us for the next 12 years. Any new measure must really add value and bring a form of revelation to us, show us and tell us something new. The data should stimulate meaningful action, not just be there as an explanation, but have an impact on policy. And we must make sure that we do not impose yet another set of reporting burden on our countries that we've just tried to reduce yesterday when you all adopted the joint monitoring framework. This has to preferably be done through routine data, but minimizing any additional burden so that it is also not a crux for you. And of course, they need to be sound, they need to be comparable. That's probably the biggest challenge of all, to be comparable across the region when concepts differ so much culturally between the different member states in this region. We will then report on the Gateway, and we will actually interact with you on the Gateway because we have new plans for this Gateway that mean there is more interaction, direct interaction with you. But the greatest challenge remains, and this is something we discussed at length yesterday. The challenge of integrating health information in your countries, but also as a region, that has not gone away. And this is something we must tackle in order to solve those issues, because this is what we're currently looking at. We're looking at countries who are these little dots reporting to international organizations. Sometimes different agencies in one country report to the same, or several of the international organizations. And we receive from multiple sources the information we require. What we need to aim for is what we discussed yesterday, and that is to have an integrated system in a country that collects all information from all sectors into one single health information system for health, and that reports into one single system in the European region. Now, Finland has done this, and I would like to congratulate again our colleagues from Finland for doing this. This is a tremendous achievement. You are the world leaders in this, and this is really something that also Europe can be very proud of, to have this country in our region. But if you want to achieve this in the region, we have still a lot of work to do, and that means harmonization and interoperability need to be moved forward. And how can we do this? Well, we heard yesterday a lot from you and the day before about the European Health Information Initiative. This is WHO's initiative with member states and many other partners that is the platform to move this forward. And we're very grateful for the call from Slovakia and the Visegrad countries to say that practically everybody should be joining this initiative. At the moment, we have 39 participants, mostly member states. You can see this here on the right-hand side. It is chaired by Malta and the Russian Federation, but many other international players are part of this. We have the European Commission, we have the OECD, we have UFA, we have the ECDC, but we also have global players like the Wellcome Trust, the Institute for Health Metrics, and even the Commonwealth. So it is important that everyone is part of this, because what happens is when you are, you will be part of creating what we have adopted yesterday, such as the joint monitoring framework. It is also something we should be doing because we agreed to it in an action plan that you adopted in 2016, the action plan to strengthen the use of evidence, information and research for policymaking. And there we're saying that the regional office will promote and enhance the work of the EHII to harmonize and lead health information efforts in the region, together with our partners like the European Commission, like the OECD and others. And we are committed to doing so, and it says to working towards a single integrated health information system for Europe. So, where do we go next? This is my final slide. We really still have some work to do on what I just mentioned to you. So we are looking forward to working with you on this, but we also have some concrete things to do over the coming months. One of them was mentioned by the regional director. we are pursuing the establishment of a high-level task force on big data. This is extremely important. We have said big data have big opportunities, but we must also remove the noise that these data could create. And we need to communicate health information to a wider public and make sure that individuals engage with us. We have a small leaflet outside that says Health Information and You, which is directed at the individual. Please have a look and give us some feedback, because it's important that we speak to the person who provides the data to the health authorities and see whether they understand how health information is used. This is all I would like to say. I would like to thank you very much for the positive response to our report so far. As I say, this is the work of the whole office and not least the work of Dr. Shoshana Jakob. Thank you very much.
Thank you very much, Dr. Stein. I now open the floor for the debate and ask delegates wishing to speak on this issue raised under this item, please, to raise the name plates. I don't see the request from the member states. Then we move to the non-state actors, and we have one request from International Association for Hospice and Palliative Care. Please, you have a floor.
Thank you, Mr. Chair. The International Association for Hospice and Palliative Care would like to draw Member States' attention to the problematic nature of the phrase premature mortality, used several times in the report. The term effectively eliminates persons older than 69 from health policy planning. This policy strategy results from lack of disaggregated data. So the International Association for Hospice and Palliative Care urges Member States to collect the age disaggregated data. Further, we point out that there is no mention of palliative care anywhere in the report, although there are plenty of references to health promotion and prevention strategies, as well as treatment, maternal child mortality, and an entire chapter on universal coverage. Palliative care is an essential service under universal health coverage, according to WHO, and properly integrated with primary care can significantly reduce health system and out-of-pocket costs, an important focus on the report. Properly integrated palliative care can help countries meet Health 2020 Target 5 indicators. The report cites the modest treatment success rates for new pulmonary TBC cases, 77% by 2015, which also signals the need for adequate palliative care for patients with TB, in addition to HIV and the chronic and non-communicable disease affecting entire population, but most especially older persons and those over 69, whose mortality is preventable and premature. We thank the Secretariat for including older persons, but this section could have included the right to palliative and long-term care, considered by the 9th Open-Ended Working Group on Aging in July and endorsed by the Council of Europe. Thank you very much.
Thank you. I don't see any other requests for the debates. Then I would like to ask Dr. Stein for response.
Thank you, and thank you very much indeed for your comments on the report. We couldn't agree more with you that age disaggregated data are key. And in fact, this is how we request those data from our member states. Age disaggregation is important for many reasons, but so is also disaggregation by gender, by sex, by ethnicity, by other areas. You may call ethnicity in different ways, but disaggregation is important, especially if you really would like to describe inequalities and deal with social determinants of health. Now, the term premature mortality is awkward. And we think it is, of course, important to stick with what member states have agreed to in the action plan, the global action plan to combat non-communicable diseases, where premature mortality was defined in that way from 30 to 70 years of age. Of course, we also give overall mortality. You will see that also in the report for all causes and all ages. You have to actually make a choice when you write such a report. It takes 18 to 24 months to do, and we started off with something like 500 pages when we had the first draft. Of course, you cannot throw something like this at member states. And when you look actually at our Health Information Gateway, you will find all the age disaggregation that you need. You will find also the disaggregation into other areas that I described, and you will not only have premature mortality, but when you report, for example, on mandates that come from other frameworks like the NCD Global Action Framework, you cannot just remove that term. I also fully agree with you that the importance of palliative care should not be underestimated. It will increase, and with our aging populations, we believe that we will need these services more and more, but we do also believe that they are incorporated in universal health coverage. While some have been mentioned, not others. As I say, I would love to share with you the first draft we had of our 500-page document, where a lot of this is actually mentioned, but unfortunately we have to cut it somewhere. But I think it is something we should bear in mind, and I think it is something we should bear in mind not only for the next round, but perhaps we can have a discussion about this offline and see what we can do on a Health Information Gateway to be more conscious of this. This is really my response to this. I fully understand your points. You're right. And thank you for making the point about age disaggregated data. That is really a very important comment to make. Thank you very much. Thank you, Mr. Chairman.
Thank you very much, Dr. Stein. There is no resolution linked to this agenda item, so we will now, we are a little ahead our time agenda, but we discussed and we will now announce the lunch break. I guess this morning was very important and productive morning. Thank you very much for intensive debates.